Hi there. Welcome to Anonymity 1D. My name is Alex. My son Miguel was recently diagnosed with type 1 diabetes.
And my name is Dr. Shruti Ahuja. I am Miguel's pediatric endocrinologist. In this video, we will go over the honeymoon phase seen in type 1 diabetes. Please remember that this is for educational purposes only and is not meant to replace your doctor or care team. Thank you. So Alex, looking at Miguel's sensor download, he seems to be having a lot of nighttime lows, so we should cut back on his nighttime insulin.
That's what I was thinking too. We have been cutting back on that steadily over the last few weeks. Why is that?
That is because of a phenomenon called honeymoon. The honeymoon phase can happen soon after diagnosis. Blood sugar levels improve and insulin requirements decrease. This is because the remaining beta cells in the pancreas still produce insulin, so his insulin doses need to be cut back.
How does that happen?
When Miguel was diagnosed 3 months ago, his pancreas had lost a significant number of beta cells, which is the insulin factory. He probably had some reserve, but not enough to keep his blood sugars in range. So, as his insulin reserve dropped, his blood sugar rose and led to diabetes. As he started getting insulin through injections, his blood sugars improved and the body's stress level dropped. Stress can cause insulin resistance, so as the stress drops, insulin resistance also decreases. At that time, the few functioning beta cells that remain may start producing some insulin. This can lead to hypoglycemia, which is why we cut back on Miguel's doses.
Does this happen to everyone after diagnosis?
About half of people with type 1 diabetes can go through the honeymoon phase, so it is quite common but does not happen to all.
Can he get to a point where he does not need any insulin?
Most of the time, the insulin needs go down significantly, which is sometimes referred to as partial remission, but occasionally, insulin needs to be stopped altogether, sometimes called complete remission.
If I don't need any insulin, does that mean the diabetes has gone away?
Unfortunately, no, Miguel. At some point, the residual beta cells are not able to keep up with the insulin needs, and the blood sugar starts rising again. When that happens, we need to go up on your insulin doses to keep your blood sugar in a safe range.
How long can this last?
This phase usually lasts a few weeks to a few months. Occasionally, it can last more than a year, but it eventually ends as the insulin reserve goes down.
How do I know I need more insulin again?
This is where monitoring your blood sugars very closely, like with the CGM like you are doing now, is very important, so we can go up or down on your insulin doses as needed.
So even if I don't need insulin, I still need to wear my sensor?
Yes. Or check your sugars with a glucometer, some way to monitor your blood sugars.
Can the honeymoon phase be prolonged?
Though there are some thoughts about how to do that, so far, there are no scientifically proven ways to extend the honeymoon period. There are studies being done now to answer that same question. Remember, the honeymoon phase is exactly that, a phase in the type 1 diabetes journey. So needing more insulin doesn't mean that Miguel's diabetes is worsening, just that he is moving past that phase.
Got it. Can I recap so I can explain it to Miguel's mom later? The honeymoon phase is a phenomenon seen soon after diagnosis where there is some insulin production by the remaining beta cells. It is temporary and can usually last from a few weeks to several months after diagnosis. Over time, the pancreas loses its ability to produce insulin and insulin needs increase. It's essential to keep monitoring blood sugar levels so we know when the insulin needs increase.
You got it. Now let's discuss his new doses and then we are done.
We hope this gave you a better understanding of the honeymoon phase in type 1 diabetes.
Please remember that this is for educational purposes only and is not meant to replace your doctor or care team.
Don't forget to subscribe to our channel. Thank you for watching.